Welcome to the yoga program. In this, I am going to show some simple and safe postures to get relief from back pain. Stand against the wall, keep a chair in front. Rise your right leg up, rest the right foot on top of the chair. Ensure that the hips and the trunk are against the wall. Take the right foot down and chain. Stay for about 10 to 15 seconds and repeat this for 3 to 4 times. Take care to see that the pelvic rim does not rotate out of the plane of the wall. Also, take the heel closer to the wall. This posture is very useful for the gluteal muscles, especially the gluteus medius and the gluteus minimus muscles. They are also an important role to play in the health of the low back. Watch your breathing. Your inhalation and exhalation should be slow and steady. As you exhale, contract the abdominal muscles, and as you inhale, the abdominal muscles should slowly expand. Keep a chair on each side, stand against the wall, rise your right leg, keep the right foot on the seat of the chair. Take care to see that the pelvic rim does not rotate out of the plane of the wall. Chain. Stay for about 10 to 15 seconds with slow, deep breathing and repeat 3 to 4 times. As you inhale, the chest and the abdominal cavity should expand. As you exhale, they should contract. The leg which is on the floor and the hips and the trunk should be against the wall. This posture is very useful for the muscles of the inner thigh, the groin region, the medial muscles of the thigh get a good rejuvenating movement. In doing all these things, take good care of the orientation of the legs, the foot and the trunk. Come down and relax. Lie on your back. Rest the lower legs on the bolsters. Ensure that the complete spinal muscles are well rested on the floor. Watch your breathing. As you inhale, the chest and the abdominal cavity should expand. As you exhale, they should contract. Pay attention to the muscles of the low back. They also respond to the breathing. This posture is very relaxing and helps especially the abdominal muscles, in particular the transversus abdominis muscle, which has a crucial role in the health of the lower back. So use your breathing for maximum benefit. When you contract the abdominal muscles, as you exhale, you are actually helping to train the transversus abdominis muscle and also the paraspinal muscles. Keep an appropriate neck pad. You can do this posture for 4 to 5 minutes. You must relax the arms, the legs, complete trunk with due attention to breathing. Deep, slow breathing is very essential for this posture to be useful for the lower back. This posture greatly helps to relax not only the body but also the mind. Pay close attention to the lower back muscles. Flex your elbows, stretch both arms straight up. As you inhale, move the arms apart towards the floor. As you exhale, bring them back. Watch the shoulder complex. This is a gentle way to mobilize your shoulder complex. The muscles surrounding the shoulder complex get rejuvenated when you do this set of movements with synchronized breathing. The breathing and action should be synchronized. This also helps the upper back and the muscles of the chest. As you exhale, lift both arms up. When they reach the topmost point, exhalation should have ended. Then as you inhale, move them apart. When they touch the floor, your inhalation should have ended. This kind of a synchronized movement with the breathing helps not only the arms and the shoulders, but also your mind to relax. Relax the arms. This can be repeated 8 to 10 times. Take the arms closer to the trunk with palm facing the floor. As you inhale, lift both arms up. And as you exhale, bring them back. Even here, ensure that as you inhale, the chest and the abdominal cavity expand, and as you exhale, they contract. Keep the arms straight, move them gently, synchronize the movements with the breathing. Watch the movement of the scapulae. This is a very good gentle mobilizer for all the muscles of the shoulder complex. And when you move the arms, feel also the weight of the arms. Get completely involved with both the action and the breath. This can be repeated 8 to 10 times. This helps the chest muscles to get a gentle, healthy stretch. The arm movements and the breathing are very good for the upper back and also the muscles of the chest, the intercostal muscles also get a rejuvenating effect. Relax. Fold your right leg, moving the knee to the chest, stretch the heel. This is very useful for the gluteus minimus and the medius muscles. Relax the right leg, chain. In this posture also, pay attention to deep, slow breathing. As we inhale, the chest and the abdominal cavity should expand. As we exhale, they should contract. You can repeat 3 to 4 times. Be aware of the gentle stretch in the muscles of the hips. Through that, the muscles of the lower back. The hip muscles have a good bearing on the proper functioning of the lower back muscles. These gentle movements help to mobilize the lumbo-pelvic hip complex in a very healthy way. These movements can be done both at the beginning of the day and towards the end of the day. Pay close attention to the breathing. Relax the legs. Fold right leg. Hold the knee from both hands. Press the knee as close to the chest as possible. Stretch also the right foot. The toes and the arch of the foot, the ankle joint should also feel the stretch. Breathing should be slow and deep. Release the right leg, chain. Stay for at least 15 seconds with slow, deep breathing and watch the posterior region, that is the thoracolumbar fascia. Even this region, as we inhale, it expands, and as we exhale, it contracts. This is the so-called nature's back belt. Then relax. Fold right leg, hold the knee, press the knee towards the chest. Pay attention to the movements of the muscles on the lower back. It is very important to increase your awareness, go deeper into your muscles, use your breath to create a better awareness in and around the lower back musculature. That awareness helps to greatly enhance the health of the lower back. Relax. Fold your right leg, taking the right foot across the left thigh and gently push the right knee towards the bolsters. Slow deep inhalation, slow deep exhalation. Your inhalation should be so deep that you are able to feel even your pelvic cavity. Release the right leg, chain. This movement is very useful for the sacroiliac joint. There is the articulation between the spinal column and the hip bone. The sacrum of the spinal column and the iliac of the hip bone, they articulate. This is a very important joint which gives the foundation for the spinal column. Stay for 10 to 15 seconds. Repeat 3 to 4 times. As you inhale, the chest, the abdomen and the pelvic cavity, that is the lowermost portion of the abdominal region, should expand. And as you exhale, the chest, the abdomen and even the pelvic cavity should contract. So while exhaling, you must ensure that the contraction is good enough to sensitize the pelvic zone. And develop a feel for the base of the spine. This is much below the lower back. You must use your breath to irrigate the muscles of the lumbar spine and the sacrum. Relax. Stretch your right leg, pull the kneecap, stretch the heel. This is useful for the legs. This helps your Achilles tendon, the gastrocnemius muscle, the thigh muscles, especially the hamstring muscles. Relax the right leg, chain. The muscles of the thigh and the lower back are connected. This is so-called kinetic chain in the system. The hamstring muscle is connected to the hip bone. The hip bone forms the foundation for the spinal column. Therefore, gently mobilizing these muscles is imperative for the health of the lower back. Stay 10 to 15 seconds. Repeat 3 to 4 times. You must stretch the heel, pull the kneecap, tighten the muscles of the thigh. You can rest the back of the thigh against the bolster. Use your breathing properly to feel the muscles of the lower back. Relax. Fold your right leg. Hold the right ankle from left hand, and from right hand push the right knee across the chest. Try to bring the knee closer to the chest Breathe slow, deep. Relax the right leg, then chain. You must gently push the knee. Feel the muscles of the hips and also the muscles of the lower back. This particular movement is very useful for the gluteus maximus muscle, which is one of the big muscles of our system. The gluteal muscles have a direct impact on the health of the lower back. Therefore, these stretches help in the proper functioning of the lower back muscles. Repeat 3 to 4 times and relax. Fold both legs. Hold the knee. Press the knee gently towards the chest. Stretch the heel. Feel the lower back area and also the upper back area, especially the thoracolumbar fascia, the thick tissue that is resting on the floor. So as we inhale and exhale, sensitize this area. Stay for 2 minutes. Release the legs. Relax. Lie on your back. Keep 2 bolsters. Fold your right leg. Rest the lower leg on the bolster. Stretch the right heel. Keep the right foot also active. Left leg absolutely straight. Slow inhalation, slow exhalation. Stay in the posture for 1 to 2 minutes. Repeat 3 to 4 times. This is a useful posture for the groin region, that is the root of the thigh, and also the inner muscles of the thigh. Ensure that the pelvic rim, that is the hip, does not rotate out of the plane of the floor. Repeat 3 to 4 times. As we inhale, chest and the abdominal pelvic cavity should expand. As we exhale, they should contract. Try to keep an angle of 90 degrees at the folded leg. Feel the muscles of the lumbo-pelvic hip complex. So deepen your awareness for the area around the lower back. Breathing is the foundation for you to get involved and evolve in the posture. Relax. Slowly roll on to the prone position on your chest. Fold your right leg. Rest the right knee and the leg on the bolster. Ensure that the trunk is properly oriented towards the floor. Chain. Stay in the posture for 1 to 2 minutes. Repeat 3 to 4 times. Feel the muscles of the hip and the lower back. The muscles connecting the lower back and the upper back. The obliquely oriented group. They get a good mobilization through this posture. As you inhale, pay attention to the muscles of the lower back, muscles of the thigh. This is very good for the complete musculature around the hip and also the inner thigh. The orientations given through the postures should be properly felt through the medium of breathing. You must be able to feel the targeted muscles in these postures. Feel the spinal column, how the muscles of the hip and the lower back get rejuvenated. Press the palm and then slowly get up. Sit upright, take the palms forward, rest the knee on a pillow. Sit in this all fours position. Palm below the shoulders, shoulder width apart, knee below the hips, hips width apart, trunk nearly parallel to the ground. Now slowly rise your right hand up. Stay for about 10 to 15 seconds. This is a useful posture to give stability to the muscles of the lower back and the upper back. Chain. This helps the scapular region and also the complete spinal musculature. Repeat 3 to 4 times. Stability is very essential. The lower back quite often gets into problem because of poor stability more than strength and flexibility. Even in these postures, pay attention to good breathing. Slow, deep inhalation is very essential. Now raise your right leg and stretch to the level of the hips. Ensure that the trunk is not disturbed. Relax the right leg, chain. Stay for 10 to 15 seconds. Repeat 3 to 4 times. As you inhale, the chest and the abdominal cavity should expand. As you exhale, they should contract. In particular, contract the abdominal muscles as you exhale. This posture helps to stabilize the muscles connecting the hip and the lower back. These gentle movements impart stability to the complete kinetic chain associated with the lower back. The movement should be gentle and well coordinated with the breathing. Raise your left hand and right leg up. Maintain the orientation of the trunk properly. Chain. Raise your right hand and left leg up. Pay attention to the breathing. Watch the pelvic girdle and the pectoral girdle. That is the hip girdle and the shoulder girdle. Watch the muscles connecting them. This posture imparts good stability for the muscles connecting the hip girdle to the shoulder girdle. These movements particularly reinforce good stability for all the muscles that matter for the health of the lower back. Slowly come back, sit upright and relax. Keep a blanket, turn sideward, rest your right elbow and forearm on the blanket. Flex the knee. As you exhale, rise the trunk and the hips up. This is a good movement for the stability of the lateral musculature of the trunk. Descend and chain. Stay for about 20 seconds. Repeat 2 to 3 times. The elbow and the knee must be in the same plane as that of the trunk. Watch the lower back muscles, also the lateral muscles of the trunk. This is a simple side bridge posture. You can turn to the side, rest the right elbow and forearm on the blanket. Take the right leg forward, left leg backward. Inhale, exhale, rise the trunk and the hips up. Both legs straight. Slow inhalation, slow exhalation. Descend, chain. This side bridge posture helps the stability of the lower back as well as the upper back muscles. Press the right elbow and forearm. Join the foot. As you exhale, rise the trunk and the hips up. All these side bridge postures are arranged in a graded order of complexity. Use your breathing properly. Learn the orientation properly to get benefited with proper stability of the lower back. Chain. In all this, the muscles of the trunk, especially the lateral muscles, get a good stabilizing effect. In each of these side bridge postures, stay for about 15 to 20 seconds. Repeat 3 to 4 times. Sit upright, relax. Take the palms forward. Flex the elbow. Keep the elbows on the floor, knee on the floor. Flex the knee. Hold the trunk. Stay with slow, deep inhalation and exhalation. Relax the legs and now straighten the legs. This is the prone bridge, which helps to give stability to the upper back and the lower back. Raise your right foot up, stay for 10 seconds, then change. This may be repeated 3 to 4 times. Slowly come up, sit upright, relax. Take the arms back, flex the elbow, rest the forearm and the elbow on the floor, flex the knee, keep the foot closer to the hips, exhale, rise the hips up. Stay for 10 to 15 seconds, repeat 3 to 4 times. This helps the stability of the muscles connecting the hip and the low back. Stretch both legs forward. Keep the legs straight. Breathe properly. Descend. Then sit upright. Lie on your back, hips and the complete trunk properly rested, heel closer to the hips, rise both arms up, slowly inhale. As we exhale, contract the abdominal muscles, rise the hips up, press the foot firmly on the floor. Take the chest towards the chin. Slow inhalation, slow exhalation. As you exhale, contract the abdominal muscles. Stay for 20 seconds. Relax. Exhale and rise the hips up. The posture can be repeated 3 to 4 times. Do not hold the breath. Relax. Rise the hips as we exhale. Then slowly stretch the right leg up in line with the trunk. Stretch the heel, the calf and the thigh. Take the right foot down, chain. Pull the kneecap. This can be repeated 2 to 3 times. Each time stay for about 10 to 15 seconds. This posture in particular imparts stability to the muscles connecting the thigh and the hip. Through that, the lower back is naturally benefited. Slowly get up, sit upright, take the palms forward, legs back, lie down in the prone position, flex the elbows, keep the palm below the shoulders. Inhale, exhale, rise the trunk up. Press the palm, middle finger pointing forward. Bellow upon the shoulder joint. Slowly come down. This posture may be repeated 5 to 6 times. This gives a good backward bending for the spinal column. This helps the chest cavity and the arms as well. The complete paraspinal muscles get a rejuvenating movement in this posture. Breathing should be slow and deep. Slowly get up, sit upright, relax. Take the palms forward, lie on your chest, stretch both arms forward, raise your right leg up, rest the right foot on the chair. When you do this, ensure that the pelvic rim does not rotate. Right leg down, chain. The support of the chair helps to orient the muscles properly. Even here, breathing should be slow and deep. The posture may be repeated 4 to 5 times. This is very beneficial for the quadricep muscles, the front of the thigh, and through that the hip. The quadricep muscles are connected to the hip, and the hip bone forms the foundation for the orientation of the spinal column. So that way, all these movements contribute for the health of the lower back. Relax the legs. Rise both legs up, rest the foot on the chair and straighten both the legs. This will help the region of the tailbone also. Flex the arms, press the palm, slowly get up, sit upright and relax. Lie down sideward, resting the right elbow, flex the right knee at 90 degrees and turn the trunk. Give a nice twisting movement for the trunk, pressing the palm and slowly lean forward. So this is an excellent movement for the oblique muscles, both anterior and posterior. Slowly come up, chain. Lie down sideward. The leg which is closer to the ground is flexed at 90 degrees. The other leg is kept straight. Press the palm. As you exhale, nicely, gently twist the trunk and slowly lean forward. Use your breathing to feel the concerned muscles. Stay for 15 to 20 seconds. Repeat 2 to 3 times. Then relax. Sit on a chair. Sit to the side. Keep the spinal column upright. Hold the top of the chair from the palm. Inhale, exhale. Gently twist the trunk. Ensure that both shoulders are even. This is useful for the muscles connecting the hip and the shoulder girdle. Stay for 20 to 30 seconds. Then chain. This posture may be repeated 3 to 4 times. You must completely twist the trunk, stretch the spinal column up, and stay with slow, deep inhalation and exhalation. Stand against the wall, foot about 6 inches apart, parallel. Raise your right hand up. Inhale, stretch the arms. Exhale, bend to the side. This is a useful stretch for the lateral muscles of the trunk and also the arms. Gives a good sideward bending for the complete spinal column. Ensure that the hip girdle and the shoulder girdle are properly oriented against the wall. Stay for about 15 seconds with slow, deep breathing. Then come up as you inhale. As you exhale, take the right hand down. Chain. The posture may be repeated 3 to 4 times. A good stretch and a deep breathing will help one to properly rejuvenate the complete lateral musculature. Slowly come up. Repeat. When you bend to the side, watch the weight distribution on the foot. Both the foot should be properly grounded. For this, the orientation of the hips become very important. Do not sway the hip sideward. So that a very pronounced lateral bending of the spinal column and the associated musculature can be got. So using the wall as a reference will help to minimize the asymmetry in the orientation of the muscles. Remember, good breathing is the key to get most out of these postures. Through good breathing, not only the muscles get rejuvenated, but also the mind becomes relaxed.